Risk for Health Disparities, Pitt County Region 10 of North Carolina, presented by Candace Woolard, Ellen Glover, Erin Congleton, Kimberly Griegspoor, and Ragna Coles. In the 27834 zip code, Region 10, Tract 1 of Pitt County, is the highest concentrated area of poverty for the county. Containing 5,019 people, 63.3% live below poverty level. According to the Pitt County Health Needs Assessment, children in poverty are more likely to have physical, emotional, and behavioral health problems. Households are overcrowded, and many lack kitchens and/or plumbing. Only 1,665 of the 5,019 people in this area are 25 and over, so the majority of the population is young. 71.3% residents in this area are white, 27.8% are African American, and 3.5% are Hispanic. The median household income is $14,504 per year. 77.8% of people in this area pay 30% or more of their income to rent. This area has two major health concerns: a high rate of incidence of sexually transmitted disease accompanied by poor maternal, fetal, and infant health. When conducting the windshield survey for 27834, it is noted to be one of the larger areas covered by zip code in the North Carolina zip code areas, and this area resides entirely in Pitt County. It includes elementary schools, high schools, as well as businesses, organizations, and community service locations. When driving, it is hard to define where the zip code begins and ends because the areas overlap from both town-like areas to more rural areas. The primary school for this area is J.H. Rose High School. There are child care centers, Christian, private, public, magnet, and homeschooling noted in this area. Homeschooling is noted to be on the rise in this county. The Employment Security Commission for this area is located nearby. Some hazards identified in this area are related to brief warnings for pedestrian crossings and the failure to maintain sidewalks. Traffic for most of this area has in the past been quite heavy, with histories of people on bicycles being hit by motor vehicles when riding. Another known hazard about this area is the thriving gang population. Not seen during this windshield survey, but known about this area of town, are a number of illegal gambling facilities, as well as homes that sell alcohol by the glass illegally without regard to age. Available in these homes are the access to illegal drugs. The Greenville Police Department has a division that deals explicitly with this specific population. There are cabs and buses that can assist with transportation needs, though use may be dependent upon availability of funds. Public transit sites seem to reach out to a lot of areas, but for many residents there is the need to walk. Currently, the buses that normally run are not, due to the shelter-in-place orders currently ordered by the government for social distancing. Several people are still noted to be out and about during the windshield survey and do not appear to be maintaining the recommended 6 feet distance from one another. Sidewalks are noted everywhere that I have driven, and they are in need of maintenance. This particular zip code includes many different types of housing, consisting of apartments, townhouses, condominiums, housing projects, and the Greenville Homeless Shelter. From the windshield survey, the architecture of the homes appeared to be intermingled between homes and apartments being built in the 1960s to newer homes and apartments appearing to have been built in the 2000s. The state of repair is also intermingled, with some areas appearing to have undergone community renovation, as noted in the housing area by updated fresh paint and new paving. In other regions, housing needs to be updated and renovated. Around the high school, there seems to be more of a state of disrepair, and the housing appears to consist mostly of rental properties. The city has access to all utilities, including water, gas, electric, and phone. Unfortunately, some areas have had extensive vandalism, and these areas appear to be less populated. There are many different shops and sidewalks throughout most of this area. There are also gas stations that have items for sale as well. There are grocery stores, drive-thrus, sit-down restaurants, small and large convenience stores. There is a local area playground for children appearing to be from small children to age 12. At present, during the later morning hours when driving through, these playgrounds have been empty. There is also an exercise area for the community, but the local greenway that is usually quite busy is void of any activity. Again, this may be related to the COVID-19 virus warning for shelter in place. There are recreational centers for young adults, including the Boys and Girls Club, and there is also a fitness center geared toward adults and school programs and other community outing programs. In this same area, there is a senior center gymnasium used for practicing and performing senior games and exercising. During this windshield survey, there were minimal people noted to be out and about. The population seems to be diverse, with more African American people seen out walking. Depending upon where you go, there may be signs printed in Spanish. The signage is especially true in the parks, businesses, and community centers, and the Employment Security Commission office. Police and school resource officers are usually out and about around J.H. Rose High School, but this is not happening at this time. During the windshield survey, there has not been any stray animals noted or individuals walking their dogs for that matter. In this particular area, there are many different religions noted, and I witnessed several different church buildings. Some of these buildings share various services, including different types of religious services, all within the same building, and this seems to cause no conflict. In an interview with Ms. Nelson, Senior Administrator of Community Health Programs with Vidant Medical Center, she describes the health of the community in Pitt County as she has been involved in community health programs in the region for 25 years. Ms. Nelson states the goal of public health is to improve the health of a population. Public health interventions such as safe water sources, immunization programs, and improved motor vehicle safety regulations account for the majority of years of life expectancy gained in the United States over the past 100 years. Priority health concerns for Pitt County include access to health services, economy, exercise, nutrition and weight management, immunizations and infectious disease testing, including STDs, maternal, fetal, and infant health, occupational and environmental health, other chronic diseases, social environment, and substance abuse. Populations with lower socioeconomic status are the most vulnerable to health disparities. A community health assessment involves obtaining and interpreting information to determine the health status of a specific community. Once community health needs are identified, public health interventions can be developed and their effectiveness evaluated using a similar approach. Information necessary for performing a community health assessment, for example, includes data on mortality rates or behavioral risk factors such as smoking. This information is available from various sources. Based upon the windshield survey of Region 10, along with information gathered from community resources, several health concerns for this community were identified. When comparing the windshield survey to the secondary data analysis, the community health picture came into clearer view. As noted in the windshield survey, this area is noted to appear unsafe with vandalism apparent, the homes in need of repair, and a lack of attention to the maintenance of sidewalks, streetscape, and buildings. The data supported this in that the majority of residents are living in poverty and can barely afford rent or household essentials. The three dimensions of community health are status, structure, and process. Status can be determined by a consensus set of indicators for assessing community health status, such as infant mortality rates, death rates, reported incidence of infectious disease, and risk factors. Risk factors include incidence of low birth weight, teen pregnancy, lack of prenatal care, childhood poverty, and poor air quality. Based upon the consensus indicators, the community health status of the zip code 27834 is poor. Infant mortality in Pitt County is 11.4, which is much higher than the North Carolina rate of 7.2 and national rate of 6. The Pitt County preterm birth rate is 12.5 compared with the North Carolina rate of 10.4. The infant mortality rate shows racial disparity. The infant mortality rate for whites is 7.8, while the infant mortality rate for African Americans is 16.8. The Pitt County Board of Health has identified infant mortality prevention as a top health priority for 2019 through 2022. STD prevention is another selected priority for this time period. Pitt County's chlamydia rate is 88% higher than the rate for North Carolina as a whole. According to NCDHHS, people who cannot afford basic needs are more likely to have difficulty accessing quality sexual health services. Therefore, consensus tracks with a higher proportion of people residing below the poverty level line are more likely to be diagnosed with STDs. According to STD surveillance reports, the 2018 annual rate per 100,000 for chlamydia in Pitt County was 1,139.4, compared with the rate of 643 for North Carolina as a whole. The Pitt County rate for gonorrhea in 2018 was 358 per 100,000, with the North Carolina rate of 227.2 per 100,000. The Pitt County rate for syphilis was 37.2 with the North Carolina rate of 28.8. The subgroup with the highest chlamydia rate in North Carolina were African American women. The STD rate as a whole was rated highest in the age group 20 to 24, with the second highest in the age group 15 to 19-year-olds. Therefore, teenage girls in Pitt County can be identified as a vulnerable population related to STDs. Structure is made up of services and resources in the community, including access to care and quality of care. It includes demographics such as socioeconomic and racial distributions, age, and education level. Resources for infant mortality include the Pitt County Infant Mortality Prevention Advisory Council and the Pitt County Health Department. Resources for STD prevention and treatment include the Pitt County Health Department walk-in clinic available twice weekly. The Youth Development Adolescent Pregnancy Prevention Program provides education within the school system for middle and high school students on preventing pregnancy and STDs. There is also a communicable disease coordinator working on evidence-based interventions to prevent STDs. Shift NC is a statewide resource for teens related to STD prevention. Process can be seen as an effective community action for health promotion, or how organizations and aggregates are able to collaborate effectively to meet the collective needs of the community. It involves community partnerships and assessment to identify needs, planning, and implementation of changes. The windshield survey is an example of this observing process. Community strengths for this area include a local health department that provides a free walk-in clinic twice a week to reduce the burden of disease, including STD checks, pregnancy tests, and condom distribution. There are prenatal care and supportive services. The Martin Pitt Partnership for Children offers support needed for first-time mothers to have a healthy pregnancy, be educated on parenthood, and provide babies with the best start in life. There is the Brody School of Medicine that provides health care resources to help the insured, uninsured, and underinsured individuals living in Pitt County. Medical accessibility is available throughout, and multiple free programs have been established to help reduce the cases of STDs and provide women with prenatal care. Gaps in community care for this area include lack of provider-patient relationship and communication with patients, lack of education, lack of access to basic needs for the residents, lack of adequate number of school nurses to provide education to patients. So even though Pitt County has multiple available resources, a lack of communication with patients seems to be an issue. Education is not being provided consistently, and for resources available for appointments seem to be hard to come by. It seems that access to the actual appointment seems to be an issue. This vulnerable population includes the uninsured, underinsured, and the poverty level for this area. The nursing diagnoses for this area include self-care deficit related to STD prevention as evidenced by the increased incident rate in this zip code. And then knowledge deficit related to prenatal care as evidenced by infant mortality rate within the 27834 zip code. Interventions for these nursing diagnoses for self-care deficit related to STD prevention as evidenced by incidence rate within the 27834. The primary intervention includes educating about prevention of STDs and the use of condoms. The secondary intervention includes encouraging annual physical exams, including STD screenings. Tertiary intervention, educating about treatment options for diagnosed STDs and ensure proper access to health care. Interventions for knowledge deficit related to prenatal care as evidenced by the mortality rate in 27834 include the primary intervention of educating on the importance of not using tobacco, alcohol, or other illicit drugs before or during pregnancy. The secondary intervention includes encouraging regular appointments with OBGYNs throughout pregnancy for proper health screenings for self and the fetus. And a tertiary intervention includes educating about the use of prenatal vitamins and proper diet to improve prenatal care. Through this community health assessment, the health within this community became much clearer. While part of a thriving medical metropolis, the residents in Region 10 of Pitt County are living in poverty. While there are stores, restaurants, and public transportation available, many of these residents still cannot afford to buy groceries, pay rent, or pay a co-payment for medical appointment. Even with the availability of medical centers and community resources, sexually transmitted disease rates are high and prenatal care is not utilized. It is important that when seeing patients with these health conditions that we ask open-ended, clarifying questions in a non-judgmental way. Offering a list of updated community resources to patients and their families providing them with the locations, contact information, and the choice to utilize the services is important. Taking that an extra step further would be arranging an appointment, a ride, or finding an assistance program for a patient to help identify and meet their specific needs. Here are our references and sources that we used in our research for this presentation. Thank you.